The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, everyone. Welcome, TMD Warriors. We are gathered for the next episode of TMD Demystified. I am Tony Urbanek. Today's program is entitled, Understanding Chronic Inflammation is Critical to Understanding TMD. Now, as those of you who follow me or follow this podcast know that I attempt to educate both my fellow dentists and physicians, but also educate the patients, primarily the patients who have TMD, who need help desperately. There are two publics, the public, the patients, potential patients, and doctors. And both the podcasts that you're watching or listening to now and the blog that I write once a week, actually I write it always on Sunday night to be published on Monday, which goes primarily to our current network providers and the large group of names we have that are interested in TMD, but that's a written document, the blog. And then the podcast, which is this issue, and then I began a live stream, which is currently produced and recorded on Saturday at noon. But all three of these attempts to bring this information out to the public and the doctors have to be modulated or written or produced in a way that both patients and doctors who have a much higher level of understanding of the problem and the science behind it can actually understand it. But today's program is going to be, unfortunately, directed primarily to doctors, although patients, certainly I encourage you to watch this, but it is produced and recorded for the purpose of validating the science behind of what I teach, the actual specific science of what I teach, and that is that chronic inflammation is the linchpin, the common denominator that creates all the disparate symptoms of TMD. It isn't a problem. TMD is not a problem with multiple sources. The source is chronic inflammation within the temporomandibular joint. Unfortunately, the dental and medical communities treat the symptoms associated with it in multiple ways, at best temporarily, at worst not at all, because they don't address the source, the cause, the common denominator, which is chronic inflammation within the temporomandibular joint. And obviously, if you can make the chronic inflammation, the source, decrease, go away, be limited, then the symptoms don't even show up. And that is not the theory, that is the fact. And this same mechanism, pathophysiology mechanism, operates in all the other joints in the body. It isn't just temporomandibular joint mechanism. This same mechanism operates on every joint in the body, and that is why orthopedic surgeons who treat the other joints in the body, both surgically and non-surgically, have figured this out more than 70 years ago, but it has not filtered down to the dental community and the portions of the medical community that treat these disparate symptoms that don't even recognize the source as TMD. So with that as an attempt to explain what we're going to do on today's episode, I want to just try to make amends to the public out there, the patients out there who are needed, because this is going to be a little deep, a little specific. Even the dentist who will watch this are going to go through many words they don't understand, because what I have done is I've queried ChatGPT on a simple question about chronic inflammation that is appropriate to ask if you know and have the knowledge that chronic inflammation creates all these symptoms. And the question that I asked ChatGPT, which is a very neutral, unbiased source of information, but as you all know by now at least, has a broad background, can within a few seconds give you all the data necessary to answer your question, whatever it might be, but more importantly, very, very unbiased. It doesn't have a bias for different kinds of treatment, and as far as temporomandibular joint issues go, it is not biased for surgery or against surgery. It's not biased for drugs or against drugs. It's just totally unbiased. And the question that I asked ChatGPT recently was a simple question. What are the cellular and cell product differences between the early inflammatory process within TMJ and within the TMJ and the late stage chronic inflammation TMD that signals or stimulates the sympathetic portion of the autonomic nervous system to cause the muscles that move a joint to contract and tighten in an attempt to assist healing and hold the joint motionless. That is the message that I have been promoting and teaching for years now, that it is chronic inflammation that is an attempt, when it gets hold within the joint, to heal itself by holding the joint motionless, which creates all of the painful symptoms of temporomandibular joint disorder, whether it be headache, earache, whether it be headache, neck pain, upper back and shoulder pain, arm, hand, finger tingling and numbness, pains that move around. The non-painful symptoms, tinnitus, subjective hearing loss, and vertigo, is a different mechanism. But for the mechanism of the painful symptoms, the non-painful symptoms are called by the ENT doctors Meniere's disease. The painful symptoms are primarily treated with symptomatic attempts to either paralyze the muscles with drugs, or Botox, which is a drug which is injected into the muscles. But those are attempts that are only temporary. If you make the inflammation go away, the symptoms go away. So in preparation for giving the information, unbiased information, that ChatGPT supplied regarding the answer to that question, what are the cellular and cell product differences between normal healing inflammation, the early inflammation, and the late stage chronic inflammation. Before we get into that, I wanted to actually bring into the record, and I'm gonna read it. It's a short, probably 90-second read on my blog that I wrote 2 days ago on the same topic, which is understanding chronic inflammation is critical to understanding TMD. So TMD, temporomandibular joint disorder, is a disease that has been misunderstood by the dental and medical community for decades. The problem has been created because TMD presents the doctors with a variety of disparate and confusing symptoms. When a doctor, especially a physician, is faced with a patient who states they have frequent headaches that are also associated with ear pain and tingling in the arms and fingers, along with a feeling that their ears are full of water and they can't hear as well in one ear as the other, the doctor doesn't know what to make of it. Compound the problem with the patient stating that the painful headaches move around from one side to the other, or that the ear is painful although the doctor can find nothing wrong with the ear or head after extensive workup, including all sorts of blood tests, x-rays, MRIs, CT scans, and physical examination. The doctor may call the patient crazy, and that these symptoms make no sense. This scenario is very common. For 70 years, the problem has flourished because no one has identified a central factor or unifying concept that explains all these confusing symptoms until recently. The common denominator that, when present, explains all the disparate symptoms is chronic inflammation within the temporomandibular joint. The problem has been that all the doctors and dentists have tried to explain all the symptoms as separate entities, which have limited their attention, treatment, and research on each symptom rather than looking for the unifying cause. This is surprising because inflammation is taught as the primary unifying concept associated with just about all disease processes and traumatic events. Inflammation is the body's response to damage, whether it is caused by bacteria, virus, or trauma. Inflammation is the body's exquisite attempt to heal itself when damaged. When unsuccessful, the inflammation changes characteristics to become what is called chronic inflammation, generating different reactions and cell types compared to initial inflammation. Chronic inflammation, when left unchecked, can damage surrounding tissues and issue warnings to other organs of the body through the nervous and endocrine system that there is unusual problems with healing. In the case of chronic inflammation within the temporomandibular joint, an attempt is made to hold the temporomandibular joint motionless to enhance healing. This is accomplished through the sympathetic portion of the autonomic nervous system, ANS. When the muscles receive the signals to hold the jaw motionless, the muscles contract and place undue traction on the coverings of the bone throughout the head and face, stimulating the pain receptors located within the periosteum, which covers the bone. These pain receptors then send signals back to the brain and are perceived by the person as pain wherever the muscles are attached. The signals from the brain signal the muscles of the jaws to hold the joint motionless, do not always arrive at the same muscles at the same time or the same way. The nerve signals can move around the face, and therefore the pain perceived can move around the face. When holding the jaw motionless is not effective in reversing the chronic inflammation, additional nerve signals are sent out to hold the entire head motionless and eventually the entire shoulder girdle motionless, creating neck and upper back and shoulder pain and tightness. The pains move around as the signals move around from jaw to neck to shoulder and from one side to the other. The non-painful symptoms of tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, and dizziness, vertigo, are created by the chronic inflammation fluid entering the middle ear through a 2-millimeter fissure in the bone which connects the jaw joint to the structures within the middle ear that control hearing and balance. So it is chronic inflammation within the temporomandibular joint that creates the various disparate symptoms of TMD. Once you understand the mechanism that creates the symptoms, you don't have to treat the symptoms any longer. You just treat the cause of the symptoms. The best way to do that is to unload the temporomandibular joint like a set of crutches unloads a damaged knee. When you unload a damaged joint, the chronic inflammation naturally dissipates and the symptoms disappear. Understanding chronic inflammation is critical to understanding the proper solution of TMD. So a device that unloads the temporomandibular joint by separating the posterior teeth according to a protocol, a careful protocol that keeps any of the posterior teeth from super erupting, because you can get super eruption if the separation goes on too long. So the protocol is 24/7 for only 2 months, then nighttime only for the rest of the patient's life. But a device that separates the posterior teeth and used correctly, according to the protocol, will take the load off the temporomandibular joint sufficiently to decrease the inflammation. When inflammation decreases, all the symptoms go away. You don't have to treat symptoms, you treat the cause. Now, getting back to my question for ChatGPT, which is very unbiased. I wanted ChatGPT to chime in, to give me an unbiased scientific description of what are the cellular and cell product differences between the early inflammatory process within the temporomandibular joint and the late stage chronic inflammation. So I'm going to share my screen, and we'll scroll through the first part of this. This is a very long presentation that ChatGPT gave me, but I'm only going to scroll through probably the first 10% of it, and then we'll wrap it up. This is going to be a rather short edition of today's podcast. For those of you who want to study it further, you can contact me if you'd like. I'll be happy to send you the entire chat, or you can stop your video and read it carefully and clear your misunderstood words, because I'm sure for the doctors there will be a few, but the concept is what I want to show you, which is the concept is that chronic inflammation has a very complex mechanism that translates and travels throughout the body and is also associated with the endocrine system in producing and helps produce the symptoms, these very disparate symptoms, all related to the chronic source, the central source, the linchpin, which is of the entire disease, which is chronic inflammation within the temporomandibular joint. So the answer that ChatGPT supplied me is as follows. The short version is that the same protective neuroimmune reflex is operating in both early and late stage TMJ inflammation, but the cellular environment, inflammatory mediators, I suspected it was mostly mediators and not the different cell types, and neural sensitization state change substantially over time. So at the beginning of the damage, you get an initial inflammatory response, but the nerve sensitization state can change substantially over time, meaning the distant parts of the body from the central nervous system, brain and brain stem, become sensitized to these signals. The sympathetic and somatic motor responses are not random muscle spasms. They are part of a biologic joint protection program driven by inflammatory signals from the synovium, that's the lining of the joint itself, the retrodistal tissues, retrodiscal tissues. That is the tissue that holds the disc in place at the back side of the joint, the rear side of the joint. I've operated on over 2,000 temporomandibular joints. I've certainly seen a lot of retrodiscal tissue, a very inflammatory tissue, by the way, a very bloody tissue. The capsule itself, the periosteum within the joint, and the subchondral, meaning the tissue below the chondrocytes of the bone. Here is the distinction. Early acute TMJ inflammation, the primary biologic goal is to protect the injured joint and initiate repair. As I said, the cells included are neutrophils, mast cells. I know you doctors are familiar with this from your basic physiology and anatomy. The resident macrophages, those are the cleanup cells that clean up the mess. Synovial lining cells, type A macrophages and like synoviocytes, and more importantly, fibroblast-like synoviocytes, FLSs. There is a vascular response, which, as you all know, causes the vessels to dilate. That's why the retrodiscal tissues are so bloody. You get this tissue that's inflamed, it gets very dilated, and when you're in there operating on a joint, you better have your bovie ready, because when you section through that retrodiscal tissue that is vasodilated, you are going to get a lot of blood. You also have the increased vascular permeability, allowing the materials, the biologics, to transfer from inside the vessels to the outside, and plasma extravasation. The early key inflammatory mediators are cytokines. We don't need to go through these individually. They're just going to give you a misunderstood word. Lipid mediators and neutropeptides. The other signaling molecules from chronic inflammation. This is all happening within chronic inflammation, which is increasing over time in intensity within the temporomandibular joint, which creates signaling molecules that go through the vascular system. The vascular system, bradykinins, histamine, serotonins, ATP, and nitric oxide. These substances sensitize the nociceptors, the painful receptors. Let me make that really clear. These signaling molecules, which get inside the vascular system, then sensitize the painful receptors within the temporomandibular joint capsule and synovium and actually sensitize things outside, well distant from the joint itself. This then activates the autonomic nervous system, sympathetic portion of the autonomic nervous system in the muscles. So all of that, which I just covered, actually is very, very technical and very, very complicated, actually, mechanisms that are occurring within the temporomandibular joint itself that then translates through the vascular system, but more specifically the autonomic nervous system, sympathetic portion, that goes then, inflammatory mediators stimulate the trigeminal nociceptors. Now this is within the central nervous system, the brainstem. The auricular temporal nerve afferents, those are the nerves going toward the brain and the brainstem, and the deep joint mechanoreceptors. These are receptors those are receptors that monitor motion of the joint, not painful receptors, the motion of the joint. And these signals enter the trigeminal spinal nucleus in the brainstem autonomic system, autonomic centers, which are very condensed areas within the brainstem, and you get spillover between the different areas of the autonomic center, and the reticular formation, which is also within the brainstem. The resulting reflex output include these three concepts: increased gamma motor neuron activity, increased muscle spindle sensitivity, and protective co-contraction of elevator muscles. So basically what it's trying to say is that you get stimulation of the muscles to contract. And especially these muscles, which all the dentists certainly know the names of: the masseter muscle, which is the one here at the corner of the jaw; the temporalis muscle, which is the big muscle that's attached to the top of the head. And patients will come in and say, "It hurts right there, doc. Every morning, doc, it hurts right there. I have a headache. I have migraine headaches that every morning hit right there." It's not a migraine headache. That is a headache created by inflammation within the temporomandibular joint, causing that muscle to contract and pull on the bone. And pull on the bone here at the corner of the jaw. And the medial and lateral pterygoids, which are muscles more deeper attached to the jaw inside the face. And patients will complain of odd symptoms, odd pains. Very frequently, they think they have sinus problem because they get pains through here. All right, the result is guarding of the joint, splinting of the joint, and restricted mandibular motion. This is analogous to paraspinal muscle spasm around an injured lumbar disc or quadriceps guarding after knee injury. That point being, this is the exact same mechanism that works to handle damage to the knee or damage to the lower back, or, as I've pointed out on many, many podcasts, elbow injury with tennis elbow. Too much repetition due to tennis will cause inflammation of the lateral epicondyle of the elbow, which creates the exact same mechanism that I just covered, that actually CPT covered for me. That is the mechanism that I speak on. That is the mechanism that is totally ignored by the dental profession in understanding temporomandibular joint disorder. And so it's been presented to you by ChatGPT, totally unbiased. It goes on for another 9 pages, and we're not going to go there. I don't need to go there. I made my point, and I don't want to carry on any longer. For those of you that question it or want to challenge it, I'm perfectly willing to take the criticism or make the comments, because this problem needs to get solved, because I can't solve it by myself here in Middle Tennessee. We need other doctors, other dentists who use this device and protocol properly, who take a very simple, brief course, basically a 2.5, maybe 3-hour course online, or you can come to Tennessee and take it once a quarter. We offer the course in person, how to use a device that handles the chronic inflammation within the temporomandibular joint. Obviously, you do need to understand the problem, which this morning on this podcast, I not only presented and read the problem itself, which was my actual blog that I wrote 2 days ago, defining the problem, and then the solution itself, which was presented by ChatGPT this morning, with the solution being unloading the temporomandibular joint according to a protocol with a device that the patient can use long enough. You have to start out 24/7, and you have to have a specially designed device that they can wear 24/7, speak with. You just can't chew with it, so you got to take it out of your mouth when you chew, but the protocol is 24/7 for 2 months, then nighttime only, indefinitely the rest of your life. And that is what we had to call the Urbanic device and protocol, because I refused to do what the patients wanted to call it. They wanted to call it the miracle device or save my life device. I refused to do that. So we'll wrap it up today. I hope that, for the patients out there who are forced to watch this, I apologize. I do apologize. I hope you got something out of it. For the doctors out there, I hope you slowed down and actually saw the truth behind and the scientific validity of what I presented here this morning to validate the fact that chronic inflammation, that is the point, that chronic inflammation creates all the symptoms. Quit trying to just treat symptoms. It's a waste of time and money. All right. Anyone who'd like to contact me, I'm available for questions, for statements, for comments, and for criticisms. Tony at tmjservices.net. Tony at tmjservices.net. And I'm available in person if anybody wants to travel to Nashville, take in one of our courses. So that being said, I look forward to the next time I'll sit down on a Tuesday morning and do the next episode of TMD Demystified. I am Tony Urbanic.